we're going to switch on over to our next speaker. It's Dawn Herring. She is a licensed marriage and family therapist specializing in trauma, healthy relationships, and caregiver burnout. She's going to talk about caring for the caregiver. Thank you very much for coming today, Dawn.
Hi, good morning, good afternoon, everyone. I'm happy to be here. I'm trying to share my slides, so I'll ask everybody to bear with me just for a minute while I sort that out. And actually, you know what, I think in the interest of time, I'm going to have whoever's helping us, Jeffrey, I think, help share my slides. Awesome. See how fast that is? It's so much better than if I was doing this all by myself. So I'm very happy to be here, and thank you for the introduction. In the next 20 minutes or so, I would like to just give us all really the opportunity to have sort of a time and a place to explore our own risk and protective factors as we consider caregiving. So my objectives in part are going to be to really define who are caregivers and what are some of the red flags and risk factors that might contribute to what we call compassion fatigue. And then lastly, identify some strategies for self-care that might help ameliorate some of these risk factors. Next slide, please. So my background has been as a Cushing survivor, and having put some of my loved ones through the caregiving ropes. But also professionally, I work with veterans and active duty service members, and some of them are very seriously wounded. So I've worked with their partners and family members who are often in a caregiving role. So my perspective is somewhat unique, both I think as a patient and as a mental health provider. And so I just want to say that coming into this. All right, next slide, please. So when I think about caregivers and I define who a caregiver is, literally, of course, they may be our spouses, our partners, they may be adult children, they may be parents. And caregivers really, in my opinion, are anybody who shows up to support and do what I call the heavy lifting, if you will. So next slide, please. Because caregivers have this unique ability to fit 25 hours of work and heavy lifting into 24 hours, I think there's a unique challenge that can place people at risk for what we call compassion fatigue. And there's a man named Charles Figley whose research has been on compassion fatigue. And his definition is perhaps my favorite. He says that compassion fatigue is the cost of caring. The cost of caring. And I think that it is as simple as that. When we care, and we care profoundly, and we sometimes feel powerless, caring can lead to fatigue. The reason I include underneath compassion fatigue, secondary trauma stress, is because anytime we're dealing with chronic illness, we're dealing with symptoms and side effects, and we're watching our loved one experience things that we were not anticipating. And trauma is not, I think some people think of trauma as that car accident or a war veteran, but I think there's plenty of traumatic responses that we can experience just from caring for another and feeling powerless at times for what they are going through. I know that as a patient, I remember sometimes feeling this secondary trauma when I would think I'm going to research this illness, and I never recommend this to anyone, but of course I would get on Google and research. And there's nothing helpful about that, right? You learn way too much and all sorts of wrong information when you decide to go Google on your own. So I think sometimes I was traumatized by what I was just seeing when I decided I'm going to learn more about this in isolation, right? Without the right professionals helping me organize the information. Next slide, please. So what are some of the red flags that as caregivers, we might want to be paying attention to? I think of them in terms of behavioral and emotional changes. sometimes people will say to me, I no longer like myself. I no longer like the person I've become. I'm cynical, I'm angry, I'm irritable, or I'm isolating more. I feel, and often people say, I just don't feel like myself. And I think that for me, while it seems so general, is such a powerful red flag for us that, all right, what do we need to do differently? Where do we need to focus to do better self-care perhaps? So behaviorally, we may find that we're not able to get done what we want to get done. We may find that we are more irritable and short with other people. Perhaps we're isolating from friends or family members that we would have spent time with in the past that were supportive to us. And emotionally, we may just notice that we don't feel like ourselves. Maybe we feel sad, maybe we feel depressed. Again, that angry, irritable. And I think one of the things that is such a simple change to notice is sleep. I always tell people, if you find that your sleep is impacted, whether it's more sleep or less sleep, or if it was historically decent sleep and now it's poor sleep, that's a red flag. And all I mean by a red flag is now we pay attention, right? This is telling us now we pay attention. Next slide, please. So I want to say just briefly, when we take a look at some of the long-term effects of compassion fatigue, what we notice overall is that we can become rather cynical. And again, that chronic sense of not feeling like ourselves, sometimes that's insidious and we don't notice it because we're so very busy doing other things. And I think the problem with the long-term effects of compassion fatigue is that they can roll over into our own physical ailments. They can impact our immune system. They can impact our mental health. And so I think that if we tend to be the type of individual who has always perceived ourselves as maybe, I can do this alone. I've always done this alone. Why would I ask for help? There's nobody to help. Or I can do this. I've got this. Sometimes we realize, maybe for the first time, that this is one thing that perhaps we can't do alone, that we do need somehow to find extra support for our own physical and mental health. Next slide, please. So what are protective factors? So protective factors are some of my favorite things to talk about. And I think one of the most protective factors really is relationship, is healthy relationship. And, you know, there's been research done on pain, physical pain. And the research shows that we can endure physical pain and actually our brain will not note it to the same extent if we are being held, if our hand is being held by another loved one while, say, our foot is in a bucket of ice water. When they researched people who were present with a partner while they had their foot in the bucket of ice water, those people were less likely to say, wow, that's really uncomfortable. The people who were alone more immediately noticed the discomfort and perceived the level of pain as higher. Now, this, I believe, comes from what we in the mental health world call healthy attachment, and the body of research called attachment theory that says we are wired for connection. And it is in connection that we find sort of our soft landing. And because I work for the military professionally, the military is fond of acronyms. So I made an acronym to try to describe to them what it is we all need. And as we talk about protective factors, I want to share this acronym with you. It is TESHD. And the T stands for touch. We all need healthy touch. COVID has really put a strain on our healthy touch, right? We don't shake hands, we don't hug, we might fist bump, we're usually virtual or extremely distanced. And without any other stressors in life, the lack of that healthy touch is sort of distressing to our attachment system. So the T is touch. With whom, from whom can we get our healthy touch? The E is for eye contact. Who is it that we get to see that sees us? If you've ever been ignored, somebody's walked by you, not paid attention, that ignoring of us activates our attachment system. It's incredibly distressing for us. So we need eye contact. And then the S and the H are for this. We need to be seen and heard accurately. If you've ever told a joke or said something and somebody misperceived it or got it wrong and got upset, what we know as human beings is that not being seen and heard accurately is incredibly distressful. I know when I had active Cushing's and I was going prior to diagnosis from doctor to doctor and my medical file was becoming large, I would see these doctors greet me with my medical file. This is before we really went electronic. And I could see their cynicism. Here's this woman in her 40s with a huge medical file. What is she hunting for? What is wrong with her? And to not be seen and heard accurately was quite a panic for me as a patient. And for caregivers who are attempting to help their loved one navigate the medical system, to not be seen and heard accurately is stressful. So those who get it, whether they are the medical professionals or our family members who can just sit with us, that is essential to our well-being. So that S and H, to be seen and heard accurately, is so important. And the last one I think goes hand in hand with that. It is to be delighted in. With whom can we just be ourselves? With whom can we sit and just say nothing or kvetch about our day? Who is going to hear us and see us and be able to just delight in us? And I always say, you know who's got this down perfectly is dogs. For anybody who owns a dog, when you arrive at home, dogs are all about touch and eye contact. They see and hear us and they delight in us, right? So I think sometimes dogs were given to us to sort of fill in the gaps when somebody else can't quite get it right. And it's probably why we have dogs sometimes for some of the mental health issues for our veterans, because the dogs are always there filling in those gaps. So when we take a look at protective factors, my favorite protective factor is relationship. And it is as easy as even being here today with one another, right? Being with people who understand is calming to our nervous system. It's calming to our attachment system, which is connected to our nervous system. There's an author named Brené Brown, and many of you may have heard of her. But she has a couple of quotes I really love. And one of them is, rarely does a response make something better. What makes something better is connection.
So in terms of protective factors, as I was saying, I think that the relationship piece is so important. But in addition to that, what are we doing for our own self-care? What is it we're doing? So I would like us to, next slide, please, discuss some basic strategies to just foster our resilience by doing better self-care. Some of this research is taken from the trauma work that I have done as a provider. But I think that the basic thing when we're looking at self-care, whether there's trauma, whether we are managing our compassion fatigue, is how do we nurture ourselves? Because it is so easy for us to give, and not even think about, what does my end look like? When have I had enough? Am I hungry? Am I tired? So I always say the first thing we can take a look at is some of the basics, the 5 senses. What is it I'm doing to calm my body? What is it I am doing to feed myself physically? Am I eating basically good? Am I getting good sleep? There's a concept also, I think that we take a look at called ambiguous loss, which is a concept that was coined by a woman named Pauline Boss. And Pauline Boss defines ambiguous loss as frozen grief. And when we have a loved one with a chronic illness and we don't know, is this going to get better? How much better? How long? This unknown can create for us what Pauline would say is frozen grief. And frozen grief or ambiguous loss is an extremely exhausting place to be. And I always say it's sort of like an open tab minimized in the background, right? on a computer screen, it's still burning energy. It's still going to contribute to some fatigue for us, but we may not notice it day in and day out as we attempt to just navigate through our day. So for ambiguous loss, I say, to whom do we go to talk about this? Can we talk with family? Can we talk with one another? And sometimes do we need to actually seek a therapist with whom to speak? And one of the questions I often get is, do I know any good therapists who work with chronic illness and particularly endocrine disorders? And you know, I actually don't have a good list of those, but I do know some who are open and willing to learn and to do their homework so that they can better support those of us in this field and those of us dealing with a loved one with a chronic illness. So in terms of strategies to foster resilience, one of the things that I think is important, support system, whatever that is, and now that we do have more online things happening, I think it's easier for us to connect nationally and internationally even, to focus on basic things like eating well, sleeping, managing our sleep hygiene. If our sleep hygiene is poor and we're struggling to get to sleep, maybe talking to our doctor about that. Is there anything that can be done to assist in improving our sleep hygiene? And also nourishing the five senses. So thinking about, what is it I love to smell? What is it I love to hear? What feels good just to my body, to calm my body down after a full day? Is it taking a bath? Is it doing woodwork in the garage? What is it I can do that can help me sort of power down after a day? And then I'm a fond believer of a form of therapy called EMDR. And some of you may have heard of EMDR. EMDR stands for eye movement, desensitization, and reprocessing. It was a form of therapy developed in particular to treat trauma. And while we don't really understand entirely how EMDR works, we know that it has some neurological underpinnings. So I recommend EMDR for a whole host of stressors. For me in particular, even with my Cushing's diagnosis, I went and got EMDR, not so much for the diagnosis, which I found to be somewhat of a relief, oddly, but for some of the experiences I'd had medically that I could not stop thinking about, and that I would define as giving me a sucker punch. So I say EMDR is for anything that gives you a sucker punch and that continues to go round and around in your head and sort of feel ill-processed, right? It's as though it won't quiet. But a component of EMDR that I think we can take away and not need to go get EMDR is that EMDR relies on what we call bilateral stimulation. So if we drew an invisible line down the body from head to toe, anytime we stimulate the left side of the body and then the right side of the body, we are calming the body. So for example, if you've ever seen anyone on the telephone outside and they're upset and they're talking on the phone, they're often pacing. They're not standing still, they're pacing. That pacing is a calming activity for the body. I say it's akin to rocking the baby, but how do we calm ourselves as adults, right? We know how to rock the baby, but what do we do to calm ourselves? So slow bilateral stimulation, like walking, is very calming to the body. On the other hand, fast bilateral stimulation, like going for a run, stimulates the body. It stimulates the mind to process. It's why often runners will say after they've run, I just feel better now. I don't really know why. I feel better. So running, working on an elliptical, anybody who does their workout on an elliptical where they can go fast, swimming, even what I would say, squeezing the fists, left, right, left, right. If we squeeze the fist slowly, we will eventually calm the body. If we squeeze the fist fast, we will eventually get the brain processing. So that is a component of EMDR without needing to go to therapy that can calm us, that may calm our children, that may calm our partners in a stressful moment. With children, when I would do EMDR, I would often engage in what I call butterfly hugs, where they just cross their arms over their shoulders and just tap on their shoulders, right? And they're giving themselves a hug. They're doing butterfly hugs. So I always say when we're trying to foster resilience and ameliorate risk, some kind of physical activity that involves bilateral stimulation is often useful. And if we could combine, say, a walk with a friend, now we've got our test and we've got our bilateral stimulation all at the same time. So the more we can do to care for ourselves by connecting with others and just doing basic, gentle activity with our body, I think goes a very far way in terms of helping foster the resilience and ameliorate the risk. And I think talking to our own doctors about any symptoms we're having is so very important, to not forget ourselves. Just because we're in the role of caregiving doesn't mean that we should take a back seat at all times. Because of course that, I know it's cliche, but that idea of put your own oxygen mask on first really matters. So that is about what I have for that. The last page I have is basic resources. So we can go to that next slide. And I just got an announcement on my phone as we're talking that says there's a power outage in my neighborhood. That's nice. I've never had that before while speaking, so my apologies. So on the resources page, I've noted a few things that I found particularly useful. The first one is just a 10-minute YouTube video that is sort of a guided imagery for stress reduction that I think can help us when we're exhausted. The second one is called Yoga Nidra, and it is by Tripura Yoga on YouTube. And it's one of my favorite companies who does just what they call sleep yoga, but it's basically just a guided imagery to help people calm down and go to sleep. The third is selfcompassion.org by a woman named Dr. Krista Neff. And I love her website. On her website, she has many free short YouTube demonstrations, and maybe they're not YouTube because they're hers, but meditations, self-compassion meditations. If you happen to be a perfectionist, then you might find that your internal critic is alive and well and kicking most of the time, and that you don't need anybody else's criticism because you do it yourself better than anyone. Good. So I like Dr. Neff's website because of some of her work, and there are quizzes we can take to sort of learn where we are in terms of our ability to have self-compassion and where do we need to go and how to get there. The next one is the Figley Institute, and these are the guys whose specialty is on compassion fatigue. So I always like to include them because for anybody concerned that you might be struggling with compassion fatigue, maybe you have enough self-compassion, but you're just darn tired, the Figley Institute website is useful. And then the last two really are the EMDR websites. These are places where you can find a therapist. I listed both because the last one, emdria.org, is actually international. So it is the international website for EMDR providers throughout the world. So somebody can plug in their city, their country, and find EMDR providers that will be available to them. Also, emdria.org is the website that shows certified providers. So in the EMDR world, we have part 1 and 2 training, and then anyone who wants to pursue further education can become certified. So the emdr.com website shows you part 1 and 2 trained providers, and the emdria.org website will show you international providers, and also those who, even in the United States, have become certified. So that concludes that part of the presentation.
Hey, Dawn.
Yeah.
I want to say thank you so much for your calm energy. Not many people can handle a power outage with such grace and style the way you do. We have worked together and on other conferences and presentations, and I just have to tell everybody, you bring that calm energy everywhere you go. And I felt a little bit like a bobblehead through your whole presentation when you're going, well, you might feel this and you might feel that. And yeah, so my head has been bobbing through the whole presentation, as I'm sure many other caregivers out there have. So let me throw a couple questions at you, because you always handled them so well, and let people know that we'll be discussing this a little bit more in the breakout session, and we can share more information if they're not in your breakout session in the next session. But there's some really good questions. Obviously, this is something that's near and dear to our hearts, because as caregivers, a lot of type A, and we want to do things right, and we want to do it ourselves. So you definitely get the community that you're talking to. The first question I have is, how do we deal with chronic stress when it's impacting the entire family unit?
Yes, right. Because we want to fix it for everybody.
Right.
Right. Boy, I think because the family unit is so important, I would say, is there anything we can do as a family to power down together? Can there be even something like a movie night, right, where energy is not going out and we're sort of recharging collectively? The first thing that came to mind literally was just everybody in the living room or a family room with their blankets and the TV, just doing power down movie night, maybe with some popcorn, or just something like that, where it's just simple, because I think we have to think simple. It can't be big, and it can involve energy out. It really has to be what will recharge us as a family unit. And sometimes it's talking about it, and yet other times we're just so done. We just want to do something totally unrelated to illness and to the stress of it all. And could it just be something as simple as watching a movie together? And I think on a bigger level, really, if it is possible to get in front of a mental health provider who can work with the family on talking about, everyone has a different perspective in a family. They're impacted differently. And sometimes it's hard for us to hear one another. And yet that neutral third party, and sometimes that could be clergy. Sometimes it could be a family member, maybe who's not in our immediate family, a wise elder. But is there somebody with whom we as a family can get in front of and just say, hey, we just need some help navigating this. I don't know if I'm hearing everybody accurately. I know how I feel. I don't know how they feel. There's usually somebody who's not talking at all, right? When I worked with adolescents, they would often come into therapy and zip up their hoodies all the way. These hoodies, they go all the way up. And then they put their chair around so their back was to me. And I thought, well, I can still do family therapy with that, because I know you're listening. Yeah. So, how can we also go with the resistance and yet include everybody?
Yeah. Okay, great start. I think I'm seeing a lot of questions on EMDR. I know that for myself personally and for Erica Webster, we have used EMDR and had great success with that. Several people asking, can family members as young as 3-year-olds, what age range really is EMDR effective?
I have done EMDR with as young as 3. I know that there are providers who specialize in the 0 to 5-year-olds who've actually done EMDR with 2-year-olds. There was a 2-year-old who was in a car accident, and that 2-year-old was brought into a session with the provider, and the parent held the 2-year-old in her lap, and the therapist guided the parent in retelling the car accident while the parent was tapping on the toddler's shoulders. And you could see her little eyes got really, really big, right, and tearful, and then calmed down. So within about 10 minutes of EMDR, that toddler was like, okay, I'm fine, can I go play now? And then the challenge was, how do we know if it works on a 2 or 3-year-old? Well, what we notice when the little ones have had some trauma is that sometimes they will regress in behavior, right? If they're potty trained, they're not potty trained anymore. They may start some biting or head banging. So when we see the amelioration of those symptoms, and they're no longer developmentally stuck, if you will, perhaps they were speaking and now they're not speaking. So when speech returns, we look at them behaviorally. What do we see behaviorally? And so it's hard to say sometimes whether it's going to work with an individual child, but I think a child therapist trained in EMDR would do a lovely job of assessing that and supporting the family. And the younger the child, of course, the more often the family member is in doing the work with the provider, because that primary attachment, of course, is with that family member, as it should.
And I would imagine that could be useful over a time span, not just a one-time deal, because there obviously are triggers, other things that may come to the surface for maybe that traumatized individual. So it's not a one and done. It can definitely be a long
Right.
term. Yeah.
I EMDR actually much later, post Cushing's, when I had to go for my annual MRI. I'd never had an anxiety disorder. I'd never had a panic attack. But the thought of getting back in that damn tube, I said to the doctor, I don't think I can do this. And I don't know why, other than I've done this one too many times.
Mm-hmm.
And so off I went to a colleague who does EMDR, because I said, look, this is not over in my life. I'm going to have more MRIs, and I need to do this without having a panic attack. So yeah, I think EMDR can come and go as a useful tool to sort of knock out a trigger as the triggers arrive.
Great. Okay, let's try another one. Do you have any advice on how to talk with our extended families about how we are struggling as primary caregivers if they themselves are struggling to come to terms with the diagnosis?
Ah,
That's a good one.
it is a good one. You know what came to for me is Brene Brown's 3-minute animated video called On Empathy. And it's funny, and it basically shows in 3 minutes, and maybe we can put that in the chat, what not to say. And again, it goes back to that quote. And I've had people just say, I'm sending this to you to watch, and we'll talk about it later. But in it, it shows with some gentle humor how when we try to say the right thing, we kind of screw it up, and how sometimes saying, I have no idea what to say right now, but I'm here, is the only thing that's needed. We're not expecting people to fix it. We just need to be heard. Mm. And even to say, you're struggling, I'm struggling, but can you tell us you're here? Can you tell us that you'll be here with us? So I think there's no easy answer to that. Again, sometimes it's sending in the family member who seems to have that skill the most to really just invite that the family members who are struggling with a diagnosis, so seem to be sort of in denial or think it's something else, so we don't think it's that, and that, to just invite, I say to be curious, tell me more. Tell me why you think that, just to sort of absorb and allow them their process, because often at the other end of that, we don't think it's that, or we don't agree, it's terrifying to them. It's terrifying, and they're concerned, and it's not that they're not concerned, although sometimes it seems as though they're not concerned. So I'd say one of two things. One, send them Brene Brown's little animated video on empathy and say, let's talk about this later. This is what we're needing. And the other is just to say to them, we don't need you to say anything. We just need you to know. We know this is hard for everyone. And third is just to send in a family member who is the best at being what I call Switzerland, who can be the most neutral, who can sort of absorb the cynicism or the disbelief and kind of sit with it. Because sometimes as people talk, they work it out. That may just be their initial response. And when we go with the resistance rather than against it, we may have a better outcome with those family members.
Okay, I like that a lot. Brene Brown, we will definitely put that into the chat for people. We have about 3 minutes, so this is a quick one. Not that it's any less important, but I sense a lot of us type A kind of caregivers out there. Because the question is, how can a primary caregiver engage friends and family to help without feeling guilty?
That's going to fit really nicely into our very next session. It's funny because I just have to say this. One of my points for how to manage chronic stress is that we have to learn to delegate. And I can say that, but that is the most challenging thing for somebody who is fairly sure they're going to do it better and quicker, more efficiently, more effectively than anybody else. So I say, on some level, we just have to get over ourselves, and that's not easy. And we have to also understand that if it's not done our way, the sky may still not fall. So some of that's like cognitive strategies. How do we challenge our thinking to realize I'm only one person? And if I could be cloned, that would be great. But for today, I can't be. So if the dishwasher gets loaded in a way I think is totally ridiculous, can I just let that go and not open the dishwasher? But what do I have to do to sort of divorce myself from needing to do it all? And that's different for everybody. But I think recognizing that we too deserve some self-care. And if the dishes are left in the sink, I don't think the sky is going to fall, as uncomfortable as that is. If for many of us, it's the first time in our lives that we've been faced with something that flies in direct conflict with how effective it has been to be type A, right? Generally speaking, we are rewarded in life for being type A. And all of a sudden we face something in which this is not working for me, right? This is no longer working. It's like we hit a wall. And so I say therapy is good for that. Getting a therapist who understands that and can work on strategies. I think Kristen Neff's work, her self-compassion website, is good for that because it helps us reconfigure what I call our stinking thinking.
Yeah. You did provide us with some amazing resources, and I appreciate that. I think there are some definitely places for all of us to go today, and that is with its weight in gold. So thank you again so much for being the wonderful person you are. I know you're going to be getting a lot of calls after this is done. So.
In all calls. I'm also going to see if I can get, if the power's been restored yet, or if we're going to be working from my little phone, which is less than ideal, but yeah.
We'll make it work. But
yeah. Thank you all.
Thank you.
Yes. Thank you all for being here.